You know, the partnership with the Jane and John Justin Foundation spans over 2 decades, and when I think about their partnership, it truly does bring together 2 entities that have a common belief, and that truly is that every child's life is sacred, which is keeping with our promise. Their partnership and the forming now of this institute, known as the Jane and John Justin Institute for Mind Health, brings together multiple disciplines in a format that really does have the patient and the family at the core of that delivery.
So seizures is kind of the tip of the iceberg with him, and so there's a lot of underlying conditions that are kind of difficult to treat because of the genetic epilepsy. And so we've seen lots of specialists to treat not only the seizures, but the other things that go along with that.
The Jane and John Justin Institute for Mind Health at Cook Children's will bring together the disciplines of psychiatry, psychology, neurosurgery, neurology, to be able to treat patients with a neurologic condition. And so I think being able to have all of those disciplines under one roof will support the patient being treated in that environment.
To get access to all of the services that you need to take care of your kid can be difficult. You know, healthcare is not a simple process, and it's even more difficult when you have a child with a chronic or complex medical disorder.
So we've seen the Child Study Center for his development and behavior. We've had speech, we've had OT, PT, we've seen the echo lab for his heart. We've seen all kinds of specialists.
Currently at the Child Study Center, while we are part of Cook Children's, we're in a completely separate building, not near the main medical center. And so the physicians and the psychologists and providers who work at the Child Study Center, it makes it just a lot more difficult to collaborate with the other specialties that our patients see.
So the 9 divisions in the Institute include neurology, neurosurgery, neuropsychology, child development, child psychology, a psychology department, a psychiatry department, physical medicine and rehabilitation, and pain management. We look to say, how could we do better? Where's the next step? Where do you go? And what was obvious, that despite what a great job all those individual groups did, was that we had a lot of overlap between our patients, and we saw a lot of opportunity to improve the patient experience and to improve, again, the overall outcome by working together.
I can go to brain tumor surgery, and we do a great job of that, but there's a lot that happens after the surgery that's sometimes directly impacted from the brain surgery itself, but also just the stress factor of being in the hospital, stress factor that our lives are different, that we can now have very close collaboration.
I see a benefit of the Institute for Mind Health as treating the whole child. So we know that kids with seizures, migraines, neurosurgical complaints also have anxiety, depression, and ADHD. And so I think being able to have all of their conditions treated under one roof will be so helpful for the patients and families, and will also fulfill our promise at Cook Children's.
I think that that's going to be great, just we don't have to travel between appointments as far, and also that they can coordinate better. We'll be able to talk easier amongst themselves and come up with a cohesive treatment plan for him.
It's such a joy to work here, and it's such a joy to come to work every day and work with everyone here.
When you think about an institute of this nature, not only will this impact our patients for today, but I think for future generations to come, this will truly be a model for many of our other clinical disciplines to follow in the future. This isn't just a new gift by the Justin Foundation. This is years in the making. This is a partnership that they believe in, that we believe in, and they truly have been at the forefront of pushing us, not only clinically, but also pushing us philanthropically to make something of this nature happen.
I'm most excited to see just how this works to improve the therapies, the treatments that are available, and that he can grow and just be the best version of himself that he can be.